Robin Gurwitch joins us now. She's professor of psychiatry and behavioral sciences at Duke University in the state of North Carolina, and she joins us from Durham. Robin, as a parent, a lot of times we do not know how to distinguish between normal teenage problems, if you will, and really a warning signs. We can't tell. So how do we know at what point to ask for help for our teenage children?
Yes, thank you so much for having me. I think it would be great if our teens came with manuals, but they don't. So take a look. Are you seeing significant changes in behaviors? Are you seeing teens that are having more headaches or stomach aches, greater sleep problems, more peer challenges, drops in school grades, more irritability or mood swings than typical? So any big changes that you're seeing, more withdrawal, and certainly any talk about feeling lonely or depressed or having thoughts that there's no point because I don't see a future for myself. So anything that is out of the ordinary and different for your teen, that's when it's important to ask for support.
And of course, the COVID-19 pandemic, the remote schooling, the isolation so many teens felt. Do you see that here as a big factor 2.5 years on? Have the effects lingered?
I absolutely think every study, every survey, all says the same thing. The pandemic has not been good for mental health across the board, for kids, for teens, for adults. And certainly what we're seeing with teenagers is an increase in challenges related to anxiety, depression, and thoughts of suicide in our teens that the pandemic has exacerbated. So we've seen that continuing to rise over the course of this pandemic.
Of course, getting help is such a big part of the solution here, but getting help is not always easy. First of all, a lot of times therapists and providers are booked weeks, months in advance. Then there are people who can't afford it. Then the health insurance doesn't cover it a lot of times. So what is your suggestion to families in need? What is the best resource to go out there and find the help families need?
I think you've hit the nail on the head. More and more, there's a need for mental health, and sadly, there is less and less access. And I think as the U.S. Attorney, the U.S. Surgeon General has really pointed out, it's communities, it's individuals, it's families, it's schools, it's every system that touches the lives of our teens. So one of the things I think is important to do is, can we give schools more supports and better education and knowledge about how to better support the students in their care? It's unfair to have them at school without the resources to better support the children that may need these mental health services.
And of course, Robin, I know you know this, the problem is even compounded in communities of color.
It's communities of color, our LGBTQ teens, our teens with low income, and then we have to also recognize that in the U.S. there's been over 1 million deaths, and the impact of grief, which is also affecting communities of color more, is exacerbating the problem because children are dealing with grief. We've seen a rise in racism, which is also making it harder for children and teens. So all of those combined, we have to make sure that the adults supporting them have the tools, have the skills that they can utilize to help teens cope more effectively.
All right, such an important conversation, great advice. Thank you so much, Robin Gurwitch, joining us from North Carolina.